Can you see now?
Yes,
Good.
we can see the presentation. Thank you so much, Dr. Beck.
Thank you. Sorry about the technical problem. Good afternoon, everybody, and thank you very much for inviting me to speak today. It's a great honour to speaking to such a wide range of clinicians from the UAE. Just a little bit about myself. I'm a consultant podiatrist. I work in the UK. I have 3 roles. I work as the National Clinical Director for the College of Podiatry, where I'm based in London. I also work as a professor in tissue viability at Birmingham City University. And I also have a clinical practice in Manchester, which is in the centre of the country, and it's where I'm currently locked down due to the coronavirus. People will know Manchester probably because of the famous football team that comes from there, Manchester City, obviously, and that's my little joke. So I will talk you through my experiences with Flaminal, and just to get everybody on the same page, just about the incidents about diabetic foot disease and why it's so important that we manage these patients effectively. We know that there is an increasing number of people with diabetes worldwide, and we know as a result of that there's an increasing number of people with diabetic foot ulcers. And we know now that this will form some kind of tsunami, which may be worse as a result of this COVID-19 pandemic internationally, as patients are often potentially ignored or don't try to seek health due to the pandemic. And then we may end up with significant problems as we come through this pandemic, and patients have much more presentations of chronic wounds and indeed diabetic foot ulcers. We know that DFUs results in people being hospitalized, and we know that there are issues now about patients accessing hospital, as I've just described. We know that DFUs proceed up to 83% of major and 96% of minor amputations. And if for people with diabetes who have an amputation, it's around 55% of people will have a further amputation in less than 3 years. Further to the costs related to ulceration and amputation is the mortality associated with diabetic foot disease. We see on this graph here, we can see that a patient who has a neuropathic diabetic foot ulcer has a 46% 5-year mortality. If you look further along, we can see that an ischemic diabetic foot ulcer has a 66% 5-year mortality. If we add them together, this is around a 50% mortality at 5 years for diabetic foot ulcers, which is higher than many of the common cancers that we see, such as breast, prostate cancer. But despite this, there is very little knowledge around diabetic foot disease in the community, in society, with politicians, and we very rarely see campaigns around the management of foot ulceration, despite this significant mortality and morbidity associated with diabetic foot ulcers. Just so everybody's on the same page, I've just done a brief, what I call a jigsaw approach to management of diabetic foot disease. And we need to bring all the pieces of the jigsaw together in order to be able to manage the foot ulcer effectively. One piece of the jigsaw usually means that the foot will not heal. We need to consider pressure relief or offloading, which is what we take off the foot. Usually the use of things like total contact casts or removable cast walkers or footwear to remove pressure from around and within the foot. There's also debridement, which classically in the diabetic foot is the use of sharp debridement, but we'll touch on the other methods such as autolytic debridement within this presentation. But the use of debridement, again, to remove pressure from around the edges of the wound, to reduce that nidus for pressure that causes by callus formation, and to remove necrosis and dead tissue from within the wound also. We also need to think about the patient holistically, where we consider the patient's vascular control, their diabetes management, and also the elements that may impact on healing, such as their social life, their work-life balance, their activity levels. And finally, we need to consider the wound management, which is what we put on the wound. So this is how we manage the wound symptoms. And commonly what we do here is focus on 2 elements. One is infection and bioburden, and the other is moisture balance. If we pull all the pieces of the jigsaw together, then we've got an opportunity to get the wound healed. Within this presentation, I'm really going to concentrate on the wound management, infection, and debridement elements of the jigsaw. But I wanted to make sure that everybody was assured of the pressure relief and holistic assessment do need to form part of the jigsaw to make the wound heal. We know that infection is the complication that people fear from diabetes fear most, as it results in amputation. And it's infection that is often the final causal pathway. This patient here had a mild paronychia, or a surrounding redness around the nail. The patient wasn't treated with antibiotics. The patient was advised that they should contact